To try to get folks screened, the first challenge is to make sure that they're seeing their physician. So there's been a number of initiatives, some by payers, some by societies, trying to encourage folks to go in for their annual checkup and see their physician and make sure they get screened to see if they do have diabetes. Of course, if they get identified at that point, or if they already know they have diabetes, then those are the folks who need to be referred to an ophthalmologist or a trained eye professional to make sure that they get appropriate screening. But even when that occurs, there's lots of reasons why people don't go. I mean, first of all, it's a pain in the neck. People are busy. They have other things in their lives, and this is screening. So by definition, they're not having any problems. Their eyes feel fine, their vision's good, there's no problem. And so in today's busy world, people have lots of other things keeping them busy that's in their face, let alone a problem that they can't even detect. But that's exactly the reason why they need to be screened, because we know that diabetic eye disease is without any symptoms until fairly late. And so if we wait until you notice something, you've really missed an opportunity. So physicians are encouraging their patients to get in, payers are encouraging their members to get in, and hopefully patients are getting and be screened. But even beyond just that inertia of patients being busy, there's also the issue of having to see an ophthalmologist, so it's a different office, a different place that they need to get to. In some parts of the country, that can be a distance that they need to travel. And then there's also been the issue of cost. And even for folks with insurance, there's often a share of the cost that they're responsible for. Many payers, certainly Aetna included, have been very active in creating new products for patients so that the cost that they have to pay out of pocket is either minimized or actually goes to zero, that they're not responsible for any payment for them to go and be appropriately screened. We recognize the importance of this, and even a small amount of money for some people can be a significant barrier, and we want to make sure that that barrier isn't there. So in terms of making sure that people get the care that they need and that they are getting the screening that they need, there are a number of different systems in place. Unfortunately, there's not one overall process that guarantees this, as much as we would like to see that. And so for some primary care physicians, they're responsible for doing this and they're looking out for their patients, but they don't necessarily know if their patient has been screened. They know if they've sent the patient, but they don't necessarily know if it's occurred. Now, in a big medical group practice where the ophthalmologist is part of their system, then they may be able to identify it. But in many parts of the country, that's not the case. And the patients will be going to a physician who's outside their primary care physician, and they won't know. As we move to more programs such as accountable care organizations and patient homes, that improves. But that's not the only place where we know whether somebody's seen their ophthalmologist. Now that's a role where the payer comes in. So we know if somebody's seen an ophthalmologist because we pay the ophthalmologist, and so we got a bill for it. So we can check our records to see, has there been a bill? And we're happy to pay that bill because we want that patient to be seen. And if we see that the patient has not been to an ophthalmologist, that there's been no bill submitted, then we can get in touch with that patient. We can get in touch with their physician and just say, it appears that they haven't had their screening, and we encourage it to occur. So payers are taking a much more active role in trying to provide that information to the primary care physician and that reminder to the patient. So we at Aetna have a very active case management program, and specifically one of our programs is for disease management and diabetes. And we have nurses who reach out to our members to make sure that these types of screenings are occurring, that they're seeing any specialist that would be appropriate for them to be seeing, so that these occur in as timely a fashion as possible. And also it allows our case managers to discuss with the patient what barriers may exist for them and see how we can help them overcome those.